Good afternoon. Thanks for watching. This is Now. You got Jonathan and Ashley here coming to you from the H&N Digital Center. We are expecting a live one-on-one interview with Governor Ige in just moments. I can see them setting up for it right now. Meanwhile, though, we got some other news to get to. The state's death toll continues to climb.
That's right. The state health department is reporting 8 more COVID-related deaths today. The latest fatalities include 7 people hospitalized on Oahu, 3 women and 4 men ranging in age from their 30s to over 80 years old. There was also 1 death reported on Maui, a man in his 70s who died at home. DOH also reporting 625 new infections today. The breakdown by island shows the Big Island with 100 cases, 96 on Maui, 2 on Lanai, 2 on Molokai. Kauai, the state is reporting 39 cases. Oahu, 376. Out of state, we have 10 people diagnosed there.
And we have even more news to get to as we await the governor. Multiple people were shot overnight at a suspected game room. Lacey Denise has those details.
HPD has launched an attempted murder investigation following a shooting at a game room. Police say 3 men in their 20s had guns when they entered a game room in the Ke'eaumoku area on Sheridan Street at around 7:20 last night. One of them shot 3 game room employees, 2 men and a woman, all in their 40s. The suspects took cash and took off in a car that drove toward Pi'ikoi Street. No arrests so far. The shooting victims were reportedly taken to the hospital in serious but stable condition. We'll have the very latest on this story coming up on later editions of Hawaii News Now and on your HNN digital platforms. For This Is Now, I'm Lacey Denise.
Health officials say local vaccination numbers are on the move. Here's an update from Hilton Rathel. He's the president and CEO of the Healthcare Association of Hawaii.
Finally seeing some encouraging news in regard to vaccinations. So they had been flat for a while and flat at a very low level. So a very low number of vaccinations compared to where we were a few months ago. We had hoped that when the mandates came out that that would result in a fairly rapid rise. Didn't happen for a little while, but when we look at what's happened over the last week, we are encouraged. And there is some strong evidence now that that trend that we'd hoped would happen has indeed happened. So the 7-day average for the last 7 days is just over 5,100 vaccinations a day, which is a material jump from where we've been, which is 2,000 to 3,000 shots a day.
New restrictions on large gatherings on Oahu go into effect today. Groups are generally limited to 10 people indoors and 25 outdoors. This includes all social gatherings, including at parks, beaches, trails, and campgrounds. It also affects restaurants and bars, commercial attractions, and movie theaters. Gyms and fitness facilities will also have to observe the group limit or run at 50% capacity. And it's the same for large events like weddings, conferences, concerts, and ticketed sporting events. Indoor and outdoor organized sports are allowed. That includes youth sports, but spectators must abide by the gathering limits. We have a full detailed breakdown at hawaiinewsnow.com. Hotel executives, meanwhile, are questioning if visitors are really the problem. This, of course, comes after Governor Ige's plea earlier this week for tourists to postpone their trips to Hawaii. Tourism officials say the Safe Travels program weeds out most infected travelers, and most of Hawaii's cases are among residents. But others say it's unfair to restrict local gatherings and businesses while allowing visitors at state parks. Here's Mufi Hanneman, CEO of the Hawaii Lodging and Tourism Association.
Proof in the poi, if you will, is that they pointed out constantly, the governor and other officials, that the root of the cause of this uptick in what we're seeing with the variant is not the tourists. They've said that. More than 90% of the people that are being hospitalized are local residents. So we still have ways to go in trying to get that message across. And that's what we were willing and have been willing and will continue to do, is work on that aspect of it, as opposed to now saying, you shouldn't travel. Coming now out of a season where we're traditionally going to be slow, seats are going to be cut and visitor arrivals are going to be double-digit decreases. It's a slow season. And then you're faced with another predicament of people now receiving their 300 plus up check. And so they're going to be really eager to go to work. So it's very complicated and confusing right now. And we want to try to do our best to make some semblance of what's going on so that we don't really fall 5 steps backward as we're trying to go forward in a safe, healthy, responsible way.
The summer tourism surge is coming down and visitor numbers will be dropping further in the fall. Critics say the governor's request to potential visitors needs to be backed up by actions.
It's mixed messages, and also the finger pointing towards the community, right? They're being vindictive against the community, but at the same time allowing tourists to do pretty much whatever they want. And there's a double standard going on here. We're being told stay home, keep our gatherings limited, while corporations in the tourist industry are allowed to have huge luaus and host these large events for tourists. And the state is supporting tourist attractions.
New today, Delta Airlines isn't requiring employees to get vaccinated against COVID-19, but it is making life pretty tough for those who don't. The airline is instituting a new policy that requires unvaccinated employees to take a COVID test each week. Workers enrolled in Delta's account-based healthcare plan will also have to pay a $200 monthly surcharge. Delta says that's to offset the $40,000 it costs to hospitalize each COVID patient. The weekly test requirement goes into effect September 12th, and the monthly surcharge hits in November. Here's Delta's CEO with more on that.
Well, first and foremost, every company has to make its own decision for its culture, its people, what works according to its values. Delta is at one of the highest vaccination rates of any company I'm aware, already using voluntary measures. And I think these added voluntary steps, short of mandating a vaccine, are going to get us as close to 100% as we can. As you know, Jim, on board our planes, the plane's probably the safest place you can be. All customers are fully masked. The air circulation filtration processes work really well. And we have over 80% of our crews, both pilots and flight attendants, are already vaccinated. So I think this last step, just short of a mandate, I think will work for us.
Understood. And the data's been good. I've been watching it closely on planes throughout the pandemic in terms of, just as you say, not a lot of evidence of transmission there. I do want to ask about passengers because the question has been raised whether at some point passengers should be required to vaccinate. Have you given any consideration to that?
Well, passengers right now are required to be vaccinated to travel to most international locations.
Right.
As an American, you can travel to Europe, but only if you're vaccinated. And I think that you're going to see as international borders continue to open, that's going to be a requirement for international travel. Within the domestic system, as you said, there's no evidence that there's been spread of COVID in the domestic air transport system. And as a result of that, coupled with the logistical challenge of we're carrying millions of people a week in the domestic system, it would be quite a logistical snafu for us to try to require that domestically.
Okay, understood. I do want to ask one question about the finances. As you know, the airline industry as a whole received some $50 billion in bailout grants during the worst of the pandemic. At the time, made sense, right? I mean, aircraft travel dropped off a cliff. It has come back very quickly. I've traveled. Airports are busy, planes are busy. And while that money did help save an estimated 75,000 jobs, when you look at the cost, according to the New York Times, rather, its estimate was about $300,000 per job, in taxpayer money. And I wonder, as an airline that received that aid, are you considering returning some of that benefit, for instance, to customers?
Well, first, the $50 billion you quoted, that's only $25 billion is actually what we received in the form of grants. So Delta received a much smaller number than that.
Yeah, portion that's across the industry.
All of that money went to our. Exactly, and all of that money went to employees. That really didn't go to the companies. It went entirely to our employees to ensure that our employees maintained their jobs, and we were in position to be able to respond when it was safe to start traveling again. I think the economic return of keeping all those employees' jobs, the taxes they're paying, the employment benefit, The fact that our air transportation system in our country now is fully back compared to any other country in the world. The U.S. air transportation system has been protected, it's been maintained, and it's vital. It's an essential service. So I think it's been a great investment, and I think over time history will show it was one of the smartest things that the government did during the CARES Act negotiations.
All right, we're still waiting on the governor to get in place. He is coming into the room right now where our reporter is set up for him. But in the meanwhile, let's get to some more news while we wait for that.
Sure, Honolulu EMS crews are swamped with 911 calls, not just about COVID, but all emergency calls for help. Casey Lund shows us how ambulance crews are handling the surge.
Last week, the director of Honolulu's EMS told us they set a record, 390 calls for an emergency in a single day. Now, the first responders are used to around 250 on average per day. They tell me that they are still able to provide care not only for the COVID patients that come in, but all the other emergencies that they run into. But as those numbers continue to trend upward, things are definitely moving in the wrong direction.
We are well above pre-COVID call volume every day.
District Chief Jonathan Lee says this surge is different than any his team has experienced so far. On top of the COVID calls, crews are of course also dealing with increased tourism numbers and everyday emergencies. And the COVID calls they do go on are much different than they were last year.
Mostly what's changed is that we're seeing sicker people, younger people that are really sick, and it's pretty much all the Delta variant now.
The protocols for providing care to a COVID patient haven't changed. EMTs and paramedics don full PPE, including gowns, gloves, and N95 masks. If anything, these frontline caregivers have only stepped up their precautions.
And just to see the shift in how safety precautions are doled out by CDC, we follow CDC guidelines, and how much exposure we had before COVID came about, and how much how much we learned about how infectious diseases are spread and how much we can affect, not only ourselves, but our patients, and as well as the community.
The physical stressors of this intense work are ever present. What isn't always as noticeable are the emotional and mental tolls this job can take on the men and women who choose this work.
Our crews are really resilient. They're also can be stoic, so we might not always know. We have to kind of watch for signs of somebody that's showing some mental stress or mental duress. For the most part, our crews have been handling it okay.
And a reminder from our paramedics and EMTs, if you're not experiencing severe emergency-like symptoms, you're asked to call your doctor before calling 911 for an ambulance. Reporting at Honolulu EMS's Young Street facility, I'm Casey Lund. Now back to you.
All right, we do have the governor in place right now. Let's listen in.
Other states are reinstituting the mask mandate because we know that wearing masks are effective. I know that it's easy for people to criticize. I do know that I'm governor. I take a lot of input from different people, but I am responsible for the decisions made.
It's been said that the Delta variant has been a game changer, and that many of our restrictions, our mandates, even guidance from the health department and the federal government are now outdated. Are we now struggling to keep up with the Delta variant?
The Delta variant is a game changer, and we have been incorporating new guidance from the CDC on a regular basis. It has changed the game. As you said, we led the country in the response and the lowest infection rates and death rates for much of the 18 months that we've had to live with COVID. Delta has changed the game, and I do think that we have many in our community who are vaccinated, and the guidance from the CDC prior to Delta was that those fully vaccinated could relax and get back to normal. And I do think that right now, even for those who are fully vaccinated, I think we all need to continue the mitigation actions that we know work. It's about wearing masks. It's about staying home if they're sick and get tested if it's COVID symptoms. Maintaining physical distancing, and really for the next 4 weeks we're asking people to stay home. It's safer at home. Go out for only essential activities. we should defer any gatherings or celebrations until after we can get COVID under control.
Do you think the CDC guidance that it is safe to travel if you're vaccinated is now outdated?
I am looking forward to them updating that. We certainly, in our calls with the governors and the White House, I've asked them to revisit the CDC guidance on travel. We do know and we see here in the islands that we are seeing more hospitalizations in vaccinated individuals. We know that the disease, the symptoms are mild generally for those, even those who are hospitalized. But we do know that they can carry the virus when they're infected and they can infect others. And that's the change, I think.
In your policy making then, if you do believe then the CDC guidance is outdated in terms of travel, so can you overstep what the guidance is?
We can overstep, but we are working with our healthcare professionals here. They definitely are talking with CDC and other community health specialists, trying to determine what would make the best sense. And we make decisions that we believe can keep our community safe.
So following CDC guidance in terms of travel, do you think it's outdated, that we shouldn't even look at it anymore?
Well, I mean, I think we have to live with the CDC guidance. It's cited all across the country. But we also are looking at what our current situation is here in the islands and then making decisions that we feel is most appropriate.
You made national headlines by telling tourists that now is not the time to come to Hawaii. But it was really a request, and that your request doesn't really have any teeth. So do you think that's going to be effective in turning visitors away?
It has been effective. I know that we've gotten calls here in the office about people asking for clarification, and we're telling them to delay travel. I've seen a reduction in the visitors coming. I know that we were averaging more than 30,000 per day last week or 2 weeks ago. And today's count, or yesterday, it was about 22. So it's had, I believe, some impact. The last time that I asked voluntarily for visitors to not come to the islands, we saw about a 50% reduction in travel. I do know that based on what we're seeing in the hospitals, the fact that the facilities are full, ICUs are filling up. We have more than 400 COVID positive patients in our hospitals statewide, that now it is not a good time for travelers or residents to be traveling, and clearly we are asking our visitors to defer travel to the islands until after October.
Are you taking too much credit for the natural slowdown in tourism since this is the fall, and because people have a general COVID concern on the mainland anyway?
There is a general COVID concern. I think I'm just looking at the data and the numbers. I'm glad to see it going down. I think that that's what we would want to see. Why it's going down, it's hard to say, but I felt that it was important to get the message out. I do know, and I've heard from my colleagues as governors, that they heard the message. They recognize that we're in a very difficult situation here in the islands, and they certainly would be supportive.
How do you convince someone to not come here when they've planned for months for their Hawaiian vacation and they've invested a lot of money into coming here?
What we are working with in our industry partners is really to provide factual information about what the situation is here in the islands. Clearly, we've restricted restaurant capacity, so if they come, they may not be able to eat in the restaurants or be able to get the meals that they dreamed of in their dream vacation. Rent-a-cars are hard to find, so if they come without a reservation, they might not be able to travel to visit the the museums and other destinations that they might want. Clearly, we're restricting the destinations and reducing the capacity in all of them. So working with the partners, I'm just asking them to present what the picture is and make sure that those travelers who may have an image of what a perfect Hawaiian vacation is and why they are so motivated to do it will not get that experience if they come to the islands right now.
You're talking about the warning for travelers is really a capacity issue, just the volume of people. But are you warning visitors that they could catch COVID if they're here?
You know, certainly I think all of the visitors or people who are inclined to travel all across the country are getting that message, and it's not coming from me. You know, we do survey as part of HTA on a regular basis the propensity of people across the country and around the world, actually, and their interest in traveling to Hawaii. We've seen a significant reduction in people's wanting to travel in the last couple of weeks, 2 months, that people are saying that, especially with the Delta variant, they are less inclined to be willing to travel.
Are you willing to say that by traveling here to Hawaii, you do have a higher risk of catching COVID?
I don't believe it's a higher risk of catching COVID, but clearly traveling anywhere in the country or around the world, for that matter, is a bad idea. And I would say that travel, as I said last week, travel should be restricted to essential activities only. And if you're traveling on vacation or traveling for leisure, I would strongly recommend, regardless of where you're traveling, that you postpone it.
You had mentioned that the travel industry, airlines, had expressed understanding when you spoke to them. But the travel experts that we're talking to feel that your comments to discourage tourism are very damaging, especially at a time when tourism is slowing down anyway. What's your response to that?
You know, my response is my first responsibility is to the people of Hawaii. And we do have a situation here where our hospitals are full, our ICU units are full. We have more than 400 COVID positive patients, and we have limited capacity. We can't drive across state lines. The nearest help for the healthcare of our community is 2,500 miles away. So I recognize, and I've talked with the industry to let them know. I am doing this because I think it's important to keep our community healthy and safe. It's not something that I am doing randomly. I think it's important that we slow down the visitors to the islands. I think we need to be honest with them and let them know that they're not going to get the vacation that they dream of, and that it would be better for all of us if they were able to defer their vacation till after October.
We talked to the UH pandemic modelers, the one who give the forecasts for the next week, 2 weeks, even into the fall, and the data scientists are.
All right, for our KHNL viewers, we are going to break you away from this and take you back to your normal programming. For our digital viewers, you can continue watching this live stream.
Do you think that we are now in a COVID hurricane?
Well, we certainly are in a health crisis. You know, COVID-19 and the Delta variant is being spread through our community in very high levels. And we all need to take action to stop the spread of COVID, you know, and just as we ask people to prepare for hurricane and natural disasters, we are asking for everyone's help in responding to this healthcare emergency. It is about staying home when they're sick, getting tested if you're symptomatic, and avoid gatherings. You know, gatherings transmit the variant and transmit COVID and get more people sick.
Do you think with the scientists calling it a pandemic hurricane, is that overstating reality?
You know, I do think that, you know, they are looking at their models, and, you know, we do have epidemiologists in the Department of Health. They are projecting models as well. I mean, I think it's useful and helpful. You know, the one thing that they can't capture in a mathematical model is the human response. It really is about, you know, is Mahealani going to be motivated to respond to my request to restrict your activities? You know, and I'm hopeful, and we've seen it in the past, that when people are asked in crisis to help, they overwhelmingly do.
It's been said that there's a crisis, but people are still continuing to eat, and they are gathering, and you look outside and it's a beautiful day, it's sunny, and so what really will motivate people to take action when it's not firm and hard?
Well, you know, we are monitoring the situation, and certainly working with the hospitals to be aware of what the conditions are. And if we do have to implement more stringent restrictions, we will, in order to control this surge of COVID-19 and the Delta variant in our community.
I know you get asked about a potential lockdown all the time, and at your last news conference you said that you would take harsher measures if necessary and if Hawaii reached the breaking point. So what is the breaking point?
I mean, I think the breaking point is, you know, we are talking with the healthcare and, you know, the leaders in all of the health facilities, trying to understand what their situation is. We're bringing in additional personnel because they've said that that's what they needed, you know, 6 weeks ago when we anticipated or started to see the increase in the number of cases. So, you know, we continue to work with them to monitor what that tipping point might be, you know, and it's not a specific measure or determinant that we can point to, but certainly when we believe that the only action left untaken is a shutdown, then we'll do that.
What would be the next action? Because at least for Honolulu, there are all of the large gatherings, the city mitigated gatherings are no longer allowed. So what would be the next step?
I mean, I do think that is a lot, you know, asking people to stop gathering. You know, it's really asking people to take personal responsibility and stopping the individual gatherings at home. Is something that I think is important. You know, we have talked about different kinds of ways to restrict activity even further, but it would really be, you know, a hard limit. We limited gatherings to 10 before. We limited gatherings to 6 before, when, especially during the early days of the lockdown. In order to stop the interactions between people, which is what is spreading the virus.
What was I going to ask you? Sorry. You know, you had mentioned that the airlines were receptive to your request, and you said that the airlines would cooperate but not necessarily reduce their flying capacity. So what specifically would the airlines do in terms of discouraging vacations here?
Well, there's a couple of things, Mahealani. I cannot talk to them and ask them collectively to reduce flights. I can't talk to them about pricing. What we have been doing, and I have been doing throughout this pandemic, is we have met on a regular basis, you know, quarterly or as needed, to talk about the challenges that we were seeing. We discussed safe travels and how that would operate. We've asked them and talked with them about implementing pre-boarding clearing and scanning, so that we would avoid the check-in process upon arrival, and they've responded. So I do view it as a partnership. You know, clearly they normally would not want to see a reduction in the people that they're bringing, But I think they recognize that Hawaii is unique because we are an isolated community. And I think they recognize that they didn't want to be the cause of pushing the hospitals over the brink, and causing what we saw in New Jersey and New York in the early days of the pandemic, where, the lack of capacity really meant that healthcare professionals were choosing who would get services and who wouldn't. And, I think everyone's committed to not have that happen.
But are the airlines actually taking your message and telling their travelers now is not a good time?
I do know that regardless of whether the airlines are saying it, it's been all over the media. And clearly, we are receiving calls from travelers who were contemplating. So I think that the request for travelers to delay their vacations has been heard. And I think the airlines recognizes the situation here in the islands, and they're thinking about what actions they can do to be supportive of what needs to happen in our community.
Are your phones ringing off the hook with traveler questions now because of your announcement?
We are getting quite a lot of calls here in the office, people asking about what we meant, and asking about the fact that they were scheduled to vacation or those kinds of things. We've been telling them that now is not a good time to travel to Hawaii. We would encourage them to delay their travel to a better time after October.
Have you spoken to any governors individually, or was it more of your governor's call?
I did. No, I've been speaking with governors. I had a chance to speak with Governor Kate Brown, just talking about, and we've their situation in Oregon and Hawaii has paralleled each other. They've been very successful with vaccinations, and and things were more under control, and certainly they're having a spike, and their hospitals are where our hospitals are. They are filled. They can't take additional cases. She just said she re-implemented her mask mandate a few days ago indoors, and she just issued an order yesterday requiring mask wearing outdoors. So we talk from time to time, just because the challenges that we see are similar all across the country, and we've been through this pandemic and shared best practices and ideas, and I think we're all struggling to find a balance. We know that many in our community are vaccinated, and we don't want to get to complete shutdowns and stay-at-home orders, because that would really be devastating to businesses.
Can you talk about the requests from the Big Island Mayor and Mayor Victorino?
Yeah, we're just looking at different ways that we can respond to restrictions. We've been talking about things that we think would be helpful and work. I know that Mayor Victorino is interested in restricting activities. But he realizes that, and I think we all realize that, a hard shutdown, closing businesses and restricting activities is something that we don't believe would be acceptable to the community. And we're trying to find ways to focus on where we believe the infections are occurring and what kinds of actions we can take to restrict that.
So for Mayor Victorino's request, his request is it's not a mandatory lockdown. It's a request for visitors and for locals to just take a break. For the visitors to stay within their hotel, don't go to Hana. Does the mayor's request have any teeth?
Well, I mean, we've been talking a lot about actions that we can take and what might work and what might change the mindset of the community, because clearly we've asked collectively for people to get vaccinated. We've been asking them to limit interactions, but we still see the case counts increasing. So, I'm hopeful that the majority in our community still have that sense of community, that they would respond. And I do know that if the case counts continue to increase and we push the hospitals across that line, then we will have to go to more extreme measures and lockdowns and potentially shutting businesses.
If I'm a visitor on Maui and I spent a lot of money on my vacation and the mayor tells me, please stay at your hotel and don't go to Hana, is that really going to work?
Yeah, I don't know if it is, but clearly, I think all of us, mayors and governors, are looking for ways that we can stop the behavior that we know is spreading the virus. And people interacting is where the virus is spreading. So just as I asked visitors not to come to the state of Hawaii, I think that Mayor Victorino thought that he would ask visitors to stay within their bubbles as a commitment to our community to help keep our community safe.
There's a widespread belief, and I know you've talked about this before, but the data shows that most of the spread is locals and gatherings, and the tourists are not the root cause of the spread, but there's a widespread belief that tourists are part of the problem. So do you share that belief?
No, I mean, I do think that that tourists are not the main drivers in this spike in COVID cases, but having visitors in our islands does consume resources, right? I mean, they do eat in restaurants and they create traffic and other challenges for the community. So, and that's why we are looking at things to slow the number of visitors coming, at least temporarily, so that we can get the spike under control. But we also recognize that to have a shutdown, a hard shutdown, would mean that we would have severe impact on our economy, and the efforts to get people back to work would really be suffered horrendously.
Did you were able to get back to Mayor Mitch Roth on his request?
No, I mean, we are working through that. He has been, we've talked about some of the things that he wanted to do and, shared some suggestions about things that might be more effective. So, we continue to have that discussion, and I don't know exactly what that status is right now.
Part of his, at least original request, I don't know where the back and forth is right now, but when he first made the announcement, one of his requests was to shut down beaches and parks. Is it wise to shut down these outdoor spaces?
So, I think the dilemma that the mayor is wrestling with, and we see it here on Oahu as well, right? We do know that people being outdoors is a lot better than them being indoors, and being outdoors doesn't spread the virus. But gatherings are bad, and in talking with the mayor, the gatherings were happening in the beach parks and in the county parks. So it was sort of like we've asked people to stop gathering. We've done different things. We know that we can't enforce within all of the state parks or the county parks to stop the gatherings from happening. And so I think, Mayor Roth was just thinking that it might be preferable to just shut it down instead of allowing the gatherings to occur.
When you look at human behavior, the gatherings are happening. It's a natural part of people's behavior. If parks and beaches are shut down, doesn't that drive people indoors and make the problem worse?
Right, and that's what we were talking with the mayor about, that we would be concerned that shutting down the parks would drive them to gather someplace else, and that situation may be worse than allowing them to gather in the parks.
So would you say that particular request would no longer be imminent?
Well, I mean, we're working with the mayor. You know, he's definitely looking at his island and the data that he's seeing, identifying where the clusters are coming from, and really trying to take action to slow those clusters.
And finally, can you talk about the vaccine passport or vaccine pass? We've now seen other cities implement it. New York has it, San Francisco, Los Angeles. When is Hawaii going to come up with something like that?
So
because people in the tourism industry say, yeah, let's have it.
Well, we are working through modifications to safe travels to incorporate, you know, we already allow people to enter their vaccination information and is verifying those vaccinated in the state of Hawaii. You know, working with Clear, Common Pass, and Verify and some of the other vendors to verify vaccination status in other states. That's not as far along as we would hope. We do hope to be able to have a process off of the Safe Travels platform that would allow individuals to verify their vaccination status, and it could be used in, you know, restaurants or other venues. And so, you know, we hope to be able to get something launched, you know, by Labor Day weekend as kind of a mechanism to verify. But as you know, in most of those other cities, having your vaccination card or proof of vaccination is also acceptable in most of those situations, because there's no simple way to verify vaccination status.
So you would hope to have a vaccine pass through some sort of app by Labor Day. Would that be mandated by government, or would that be voluntary by the organization?
Well, that would be voluntary at this point. You know, we are talking with businesses and trying to understand their concerns and preferences. You know, we've had in the city and counties of Honolulu's order the ability for restaurants, for example, to recognize vaccine status as a mechanism to increase capacity in those facilities. So they've had the ability to implement verification of vaccination. And I do know that some cities have decided to mandate it, and we're considering that, but we want to work with the local businesses to really understand what their concerns would be and what would be most helpful for them.
The restaurant industry told us that the idea of their workers verifying vaccination cards was not well received. So what would be the difference?
Well, the difference to some extent is that, you know, that with a simple way, everybody has a smartphone now that would be able to have a QR code and be able to show you that I'm vaccinated, David Ige is vaccinated, may make it easier for businesses to request vaccination status and you know, be able to get higher capacities or other activities.
So that's Clear or Common Pass?
No, we would build it off of Safe Travels.
Oh, so Safe Travels.
Yeah.
Yeah. So which is Safe Travels is its own website?
Yes.
Yeah. Okay.
Yeah. And
Yep.
yeah.
Okay.
And it would be, you know, it would be a different part, right? Because we wouldn't want them to go through all the Safe Travels things,
Right,
but it would
right.
be a way
But very
to,
simple.
right,
Yep.
to say that I've entered my vaccination data and it's been confirmed.
And then the restaurant could just go to
Look
that
at,
website.
see at the code and
Yeah.
know that, yes.
Here's my green thing.
Yes, and I'm vaccinated.
All right, that was Governor Ige in a one-on-one interview with H&N. We have a team of web reporters right now writing up exactly what the governor said. We'll have a wrap-up coming up tonight on